Hi everyone, Dr. Brad Gandolfi, board certified plastic surgeon. Today I'm going to be talking about my preoperative guidelines for any adult patient of mine undergoing a major plastic surgery procedure. So we're going to start far out in advance and then move more toward the surgery as we continue. So 2 months before the surgery is when we really want to start focusing in on getting ready for that surgery procedure. And the most important thing you need to do at that 2-month mark is to stop smoking. If you're a smoker, or if you're a vapor, or if you're doing any sort of nicotine, that needs to stop so that the nicotine has a chance to get out of your system. Nicotine basically squeezes the tiny blood vessels that are really important when we're talking about plastic surgery recovery. And it stays in your system for about 6 weeks. So 2 months before, you need to go ahead and stop that. The next thing you're going to want to do is start prepping your skin. And some people like to use toning creams. I have some toning creams available. The other important part is moisturizing. And I also recommend, along with your normal skin moisturizer, that you go ahead and get a vitamin E oil with a high IU, international units per ounce. And you're going to apply that on a daily basis. Studies have shown that if you start using vitamin E oil before the surgery, that will be beneficial to you after the surgery. Next thing you really need to do is get a postoperative game plan down. Figure out if you're going to need some help, who's going to be helping you, who's going to be driving you, who's going to be picking you up from the office where we're doing the procedure. You should be looking at that and going over that stuff around 2 months before the procedure. I don't want you gaining weight or losing weight in this time frame. We want your body to be weight stable. We want your body to be receiving the appropriate amount of nutrients. And I don't want you to be overinflated as well, trying to get extra fat for some sort of transfer, because that fat will likely just die off. And then we're going to start taking some multivitamins. So a typical multivitamin is good. Really, the brand doesn't matter. I just picked these up from the local drugstore. But you want to be on a typical multivitamin to make sure that you're not getting any vitamin deficiencies. A B complex vitamin and a vitamin C, either 500 or 1,000 milligrams. I don't think it necessarily matters that much. Both of these have been shown to improve nerve healing and should be started before the operation takes place. So that's all kind of 2 months before the procedure. Now, as we move closer to the procedure, things start to change a little bit. 2 weeks before, you want to kind of get all your supplies together. And I have another video going over basically everything in the preoperative and postoperative phase I generally recommend patients get. And so you should kind of create a checklist and just make sure that you have everything on that list just in case you need it. 2 weeks before, you really shouldn't be doing any sun tanning or sunbathing. That injures the skin, damages the skin, and will leave you with a worse scar at the end of the day. 1 week before, no aspirin, no Plavix, no ibuprofen, that's Advil, Motrin, no herbal supplements unless I've gone over them, no blood thinners, and no fish oil. We want to prevent any sort of excess bleeding during the procedure, and most of those things stay in your system at least a week. So 1 week before, you need to cut all that stuff out. It's also important to start getting yourself ready. So I generally say that a large plastic surgery procedure is like running a marathon. And you wouldn't run a marathon without training for it, and so you shouldn't come into a plastic surgery procedure without training your body for it. How are you going to do that? Well, you're going to detox. Number one, I recommend no alcohol, no drugs for 2 weeks before the surgery. And at that time, I also want you eating a well-balanced, healthy diet, nothing heavy on sugar, all this stuff to just try and get you in tip-top shape, so that you're going to go into that surgery in as good a shape as possible. If you go into the surgery as good as possible, you're going to come out as good as possible. 3 days before the surgery, you're going to start using something called HibaCleanse. This is an antibacterial soap. It kills a lot of bacteria, including MRSA. I actually prep you for surgery. The day of surgery was something very similar to this. So you're gonna apply this in the shower starting 3 days before. You're gonna leave it on your skin for 2 minutes. You're gonna get it in all the crevices, not in your eyes, but belly button, all around the surgical areas that we need. So this is starting 3 days before the surgery. Now, 2 days before the surgery, you're gonna shave the area that we're operating on if it needs it. The reason we do it 2 days before is that shaving actually nicks the skin. We don't want any small cuts on the skin before the operation. So we want that done 2 days before the surgery. We give your skin 1 day to rest before. You can also wax. I don't really recommend naring or doing any sort of chemical on the skin to remove the hair in the area, because sometimes the skin reacts poorly to that. All right, so that's 2 days before. Now we're up to the day before surgery. So basically you want to check in with the office, make sure that you know the appointment time. You are gonna not eat or drink anything after midnight. You're gonna use the HIPAA cleanse again that night. Very important, after cleansing the night before, or if you're cleansing the morning of, if you have a later surgery or whatever, it's very important not to put any sort of moisturizers, oils, any of that stuff on your skin after. So we want you to clean and then put nothing on. It's okay if you show up with dry skin. Most people do. It actually helps me when I'm planning and marking the surgery. You're gonna eat a well-balanced meal. Don't eat something crazy, something heavy that's gonna make you bloated before the procedure. We don't want that. Something easy for you to digest. And then I'm gonna recommend you start taking 2 more medications. One is a stool softener. If you're gonna have surgery that's gonna require pain medication, it's going to slow your intestines down, and constipation will be an issue if we don't address it. So stool softener starting that day. And then I also recommend you start a omeprazole, which will decrease the acids in your stomach and help with heartburn after the surgery, which is a common event. All right, so next is the day of surgery. So the day of surgery, what we want you to do is arrive early, don't arrive late. Wear compression socks. You can put them on that morning, wear them to the office or the hospital, wherever you are. Wear comfortable, easy to remove clothes. Bring all your medications that you're taking with you. Bring everything, medications, vitamins, everything, so we can go over it one more time. And then, and also bring all the garments that you need after the surgery. So, potentially if it's tummy tuck, you might not have much, or if it's liposuction, you may have a faja or a compression garment or a sports bra if it's a breast surgery. There are special instructions for every different procedure, and I'll start going over those in other videos, but these are the basics that are important for each and every person that has a large operation with me. So you can go over this video a couple times just to make sure that you have everything in place. Look forward to working with you and getting you through this operative period to let you reach your goals.